So that's what we zeroed in on. And we said, gee, from the deciduous dentition to the transitional dentition, the maxillomandibular relationship has changes on these individuals. The relationship of the mandible to the cranial base changes on these individuals. That's what's causing these problems. So we tried to correct that. That's how we started to reason. And that's what we did. And so I'm going to just show you two cases of young boys that we treated. And let's start with case number 2. This is a 22-year-old boy. This is a 22-year-old male patient whom I saw the previous day. He's a Tourette's patient with all kinds of facial tics and head movement disorders and vocalizations that he cannot control. This patient makes these facial grimaces, head movements constantly, 24/7. He finds them physically exhausting.
We're going to record you through treatment so that we can keep a record of the progress.
In addition, he sweats profusely. They all sweat profusely because they're in sympathetic mode constantly. And that's why they're always exhausted.
Do you get tired as this happens?
Yeah.
It wears you out.
It wears me out a lot. I'm always tired.
What you see is tongue blades that he puts in his mouth. I have given these to him, and he bears down, and as you notice, it stops his head movements and his vocal tics instantly. Just by altering his vertical dimension.
It gives you a breather, huh? So you can relax a little bit.
This is the 3rd day since I have seen the patient. We initially took impressions of his jaws, and we have had a lower mouthpiece made over the last 2 days to fit to his mouth today.
Have you been using that temporary thing since you left?
He's never had a date, by the way. Never had sex.
More relaxed, right?
22 years old.
Yeah.
I'll start sweating.
It is a workout.
Yeah, it is. But kept it in, kept smashing down, you know, to feel a little bit
So almost like height, yeah. You were
Well,
the height.
yeah, or something else smash down real quick.
I made him an appliance, and I am in the laboratory adjusting it. You can hear the grinding noise in the background, and that is me working on his appliance. He is being interviewed by my dental assistant.
The amazing thing is you get to rest, you know, because it really is a workout. Yeah.
It's like you turn on a switch. When it comes out, he starts sweating. Because he's fighting so hard to try to keep it in.
The previous day, I gave him a bunch of tongue blades and varied the height of them up and down to alter his vertical dimension or the space between his upper and lower jaws, which will throw him from sympathetic mode. And I dispersed him with a handful of tongue blades, and he has taped them together and holds them in his mouth. Spread your lips just a little bit like that.
Hold on, let me zoom in.
Both days after the insertion of his lower appliance. Notice the absence
of his presenting symptoms, the facial tics, the vocal tics, the head movements, etc.
Tell me what the difference has been in those 12 days.
Well, I have a lot more energy. Get out places and just be able to enjoy the atmosphere and not have to worry about people, you know, looking at me, and I've been able to go sit down in restaurants, and it's been amazing treatment for me. It's helped me 100%, and I'm very blessed to have been able to reach out and do this for me.